Hello and welcome. My name is Mary Ellen Cochran, and I'm the Associate Vice President for Clinical Learning and Innovation at Redeemer Health. And we are so excited today to talk to you about a nurse's aide training program that is available to you. We are partnering with Bucks Community College, so we're going to share together what our program entails. Next slide. So why become a CNA, a certified nursing assistant? As we all know, our population is aging, and there is a great demand for caregiving. And it begins with the certified nurse's aide. You could have a career as a certified nurse's aide. You could also transition into other healthcare opportunities, such as a licensed practical nurse or an RN. Next slide. Where do CNAs work? They work all over. They work in nursing homes, hospitals, home care, hospices. Certified nurses' aides are everywhere, and it's only going to grow. Next slide. So what are the job perspectives at Redeemer Health? Well, first of all, there is a high demand for certified nursing aides. At Redeemer, we have multiple locations. We have nursing homes. We have Lafayette Redeemer. We have St. Joe's Manor. We have home care. We have the hospital. All those areas hire certified nurses' aides. And once you become an employee at Redeemer Health, and let's say you're full-time, there's lots of benefits, such as tuition reimbursement. Next slide. So now what I'd like to do is turn it over to our partner. So take it away, Karen.
Thank you, Mary Ellen. My name is Karen Souvenet. I am the program coordinator for Nurse Aide at Bucks County Community College. A couple of years ago, Mary Ellen reached out to me about a partnership with Bucks. There is such a great need for nurses' aides, particularly in the Philadelphia area, and particularly for the Holy Redeemer health system. So with our record with Department of Education and our high pass rates, we are considered the premier trainer for Bucks County. We are extending into the Philadelphia area to provide the specialized training. And I wanted to talk to you today about what the layout of the program is and what the registration process would be. Who takes CNA training? Well, a lot of people do, and it's not just nursing students. However, some of the students in your class will be a nursing student. You will have classmates that maybe are pre-med students or students who are looking to become physician's assistant. And then there are students who look at CNA as a career. Okay, CNA is a very honorable career because you have to remember nurse aides are the life force behind healthcare. They are the life force behind patient care. As nurses ourselves, we may be busy with other tasks. So we really rely, and so does your patient, really relies on you, the person at the bedside, to provide them with excellent care. And that's our goal here, is to provide you with excellent training so you can be an exemplary nurse's aide. So a lot of questions I get from people is it hard? Can I get through it? As you can see here, this is what the curriculum entails. There's a number of topics you will be taught or you will learn. You will want to be proficient in English, okay? Because the curriculum for nurse aide is not just how to make a bed and how to feed a patient. Today, nursing is evolving. Today, nursing is very technical and very skilled. So the nurse, RNs like myself, really require that you are skilled and you are knowledgeable. So the nurse aide role has really elevated in the past 10 to 20 years. And I can go back years ago when I taught LPNs. Today we train nurses aides like we did train nursing practical nurses years ago. So you can see this is the topics you will be covering in the course. It is rather quick. It's only 120 hours. So something to consider. Okay. It's very doable, but it is a dedication for the 120 hours. So how are these 120 hours rolled out? Well, we have 40 hours of theory. That's your lecture. Then you have labs, which comprise of 27 hours. So once you pass your theory and your lab practicums, you will go to clinical, which is 53 hours. And that comes out to about 8 days of clinical. Where are the locations with Holy Redeemer? Our primary classroom location is here, as pictured, which is Lafayette Redeemer, which is conveniently located on Marie Road in Northeast Philadelphia. Once you have passed your theory and labs, you will move on to the clinical portion of the program, which is St. Joseph's Manor, which is literally 5 minutes from this location. It is a quick course. Sometimes it's laid out 2 or 3 days a week. Usually the hours for class could be 9 to 2. Generally, they are 8 to 4. And we are looking into starting some evening classes, which would run 4:30 to 9:30. So the class and the clinical locations are very convenient. The hours can be very convenient, especially if you have another area that you work in, or you're a working mom, or you have other responsibilities. We try to make the training as convenient for you to get you through this program. Now, what are some of the requirements? You will have to wear a uniform, okay? And you would be responsible to purchase the uniform. As you have seen in previous photographs, we have a white smock. The students wear a black scrub pant or a black or a white sneaker. You must be in uniform on the first day, clinically ready, hair up, tattoos covered, no long earrings. We also ask that you purchase a secondhand watch. You're going to learn how to take pulses and vital signs and respirations. So you're going to need that tool, especially if you go on for your state examination. Testing. You will get 4 major exams. They are designed and laid out just like your state exam would be. You would need to get an 80 or above to graduate. But most important, like I mentioned that word commitment earlier, attendance is 100%. There are no excuses for absenteeism. The only time a student is excused is if they are hospitalized. So this is a commitment. If you have a lot of things going on in your life, you may want to come later when things settle down. I will warn you, if you do miss time in this program, we allow 7 hours. And for every hour you miss, we do charge $40 per hour. And this is why we say this is a commitment. Employability training starts in the classroom. So if you have a student who is not coming to class, they're probably not going to make a very good employee. So those disciplines start day one in this program. Now, one of the most tedious process for nurse aide is the regulations to enroll. Some of these regulations are quite detailed. So what I want to do is I want to take you through this process, because if you've been on our website, maybe you have the handbook there, or you're thinking of, or you're considering this, I want to go over everything you're going to need to turn into me. Registrations are not done in person. My main office is in Newtown. So you would not have to come to Newtown, but you will be filing these forms with me through email. But I need to go over them because they need to meet the criteria for enrollment based upon the Department of Education. They are a regulatory body. First thing, let's go over this. You need identification. I need either a Pennsylvania driver's license or a state ID. And the reason is there is a driver's license number, an ID number on that card that you're going to need to register for the drug screen, which we'll talk about a little later. So I need a photo ID, state ID, driver's license, which has your signature, but then I need a second piece of identification, which needs to have a signature. I have to compare the signatures match. So you definitely need a license or a state ID, but then you need something from List B as outlined here. What we cannot accept is Social Security cards or credit cards. We do make photocopies of these IDs. We do keep them on file. I do not want this information in the wrong hands. So we ask you do not submit a credit card or a Social Security card. And of course, a birth certificate cannot be used. You cannot sign that. So List A and List B, these are also posted in my handbook as a reference. Verification. I need to know where you live. You have to be a resident of Pennsylvania for at least 2 years. If you're not, that's fine. We'll talk about this a little bit later, but I need to verify where you live, and your identification that you submit, that address needs to match this form. If it doesn't, you need to provide a piece of mail, a lease, a utility bill, something to prove that you do live at this new address. This form needs to be filled out. So I'm going to see where you've been living in Pennsylvania for at least 2 years. You need to prove that to me in this form. This form is also found in our handbook. Now, CHRIs, this is the criminal background that you will run through the Pennsylvania State Police. And as the sampling is here, I need to see the certificate form. So when you submit your paperwork to me, you need to print out the certificate form. It has the seal of the Commonwealth of Pennsylvania behind it. Very importantly, I'm looking to see, number one, that there's no criminal record. And if there is, we'll talk about that a little later. Number two, I'm looking at the date at the bottom. When was it disseminated by the Pennsylvania State Police? It must be under 1 year, and it cannot expire prior to the end of the class that you choose to come in. If you have not lived in Pennsylvania for 2 years, you're going to have to get an FBI clearance, and that entails fingerprinting. The outline and how to do this through Indemnico is in our handbook. But after you take your fingerprinting, you're going to have to write to the Department of Education and provide them some information regarding your name, address, your email. They have to abstract the results of your fingerprinting, and then they have to clear you and send you a certified letter. This process can take up to 30 days. So if you have lived outside Pennsylvania for 2 years and you need to go have to undergo an FBI clearance, this will hold up the process 30 days. So if you notice there's a class you like that's online, know now you're going to have to work on this if you haven't lived here. If you do live in New Jersey, you certainly can take this course. But please be aware that New Jersey has changed its statutes on reciprocity. And if you live in Jersey, you're going to have to work in Pennsylvania as a certified nurse aide for at least 2 years before you can apply for reciprocity in Pennsylvania. That is new, as in within the past 2 years. Attestation. This form will attest that you have not committed any crimes that would prohibit you from coming into the program. In the handbook, there is also a list of prohibitive offenses. So in your background, let's say you have an offense or you had an occurrence once upon a time, check this list. Look at the code numbers. If those code numbers do not match the offense or occurrence that you have, please submit your documentation to me. If you're not sure, I will provide you with my private email at the end of the session. You can reach out to me and I will be able to tell you confidentially if you would need the enrollment outline. Physical. This is a form you need to use. I cannot take anybody else's form. And the main reason is I need these occupational responsibilities signed off by your healthcare provider. Nurse aides are required to be able to lift at least 40 pounds, be on their feet at least 5 hours a day, have full function of arms and legs. I need your HCP to sign you off on this. Also, there's a note where you have to be free of communicable diseases. So please, this physical form is the one I need to have signed by your health care provider. Now, another situation that arises that can be time consuming is something called the PPD or the TB clearance testing. In order to come into a long-term care facility or hospital, you have to have a TB clearance. And we do allow for a couple of routes for that to happen. So to the right, you see a chest x-ray. If you've had a chest x-ray and is under 3 years old, I can take that for enrollment. But it must be done because you're ruling out that you have TB. I cannot take a chest x-ray simply because you've had pneumonia or a chest cold, okay? The indication must be for TB testing. If your insurance allows, you can have a blood test. It's called a quantiferon. There's also another test called a T-spot. Results take only 3 to 5 days to come back. You can use that for enrollment purposes. The other is the two-step MAN-2 test. This is a series of 2 shots over a period of a number of weeks, okay? And there is a specific form you need to use for this because I have to say, a number of doctors' offices do not do this correctly. We have to follow CDC guidelines, right? So if you have your first PPD done today, you will go to your doctor's office and have it read 2 to 3 days. Then you need to wait at least 7 days before you go back for the second appointment. A lot of offices will ask you to come back 5 days later. That is incorrect. That's why this paper actually outlines the CDC guidance. I can't tell you how many applicants come through with this done incorrectly from their doctor's offices, and I can't enroll them, and the whole series has to be repeated. So I'm educating you on this. Make sure you wait at least 7 days between the first and second appointment. And it must be documented on this form. Policy. The handbook is 37 pages long. There's a number of policies. I want you to read them. I want you to be very familiar with the attendance and the academic policy, especially attendance. Please read them. And once you're comfortable, please sign this. I will expect this as part of your registration packet. A couple of questions come up with vaccines. First of all, you need the flu vaccine. You need it for the current season for 24-25, right, for this year. It cannot be last year's. The COVID vaccine is also mandatory. You will have to be COVID vaccinated. There are no exceptions. Drug screening. We drug screen here at Bucks County Community College. Okay. In the handbook, you will reach out to our vendor, who is Concord. You will pay online. You will schedule yourself online. They will send you a link for Quest Diagnostics. You can schedule yourself at any local Quest Diagnostic. This does incur a fee of $56, just to be prepared, and the results are sent to me confidentially. Now, as a side note, there are a number of people who use cannabis today for medicinal purposes. We do not accept a drug screen that is positive for cannabis as well as alcohol. And the reason is that the cannabis is still a Schedule I drug. The FDA does not see any medicinal purpose or value with cannabis. And also the clinical sites are functioning under a federal law called your Drug-Free Workplace Act. So that being said, the clinical sites will not allow students into the site with a positive drug screen, nor will the Health Sciences Department of Bucks County Community College. Your drug screen needs to be negative, and those results are sent to me confidentially. Now, the registration, like I said, you don't have to come all the way up to Newtown. What you're going to do is when you have all these documents that are outlined, especially in the handbook, you're going to reach out to me by email. Tell me you're ready, the class that you want, which would be the one in Holy Redeemer, and you're going to send them to me at my personal email. Do not send any documents to the general nurse aide email at Bucks County Community College. The reason is I have some other people who answer these emails for me. I don't want your personal information sent here in this public portal. Please send them to me confidentially at my direct email, karen.sivine@bucks.edu. In that email, you're going to scan. If you don't have a scanner, you can take pictures with your phone, but the pictures need to be very, very clear, and I need to see the entire document. Okay? Once I review your documents and I accept them, they meet compliance with Department of Education, I will send you an enrollment form, which is electronic, and you will be putting your credit card information on that form. Now, the course is $14.50. Okay, and it is due at the time of registration. We do not have any payment plans. Please note, this is non-refundable. The class will have a registration deadline. Usually it's a week before the class starts. Once you register and after that registration deadline happens, you cannot get your money back. Okay, so please be aware this is a commitment. Payment is done by credit card. You'll submit that to me electronically. And once your payment clears, we'll put you on the college roster and you will receive a confirmation of enrollment. So about a week or a couple days before the class starts, you're going to get a series of emails from my office. Number one, it's going to confirm the start time, what time I want you to arrive for orientation, because your first day of class also includes orientation. I will send you another email regarding guidelines for the campus, where to park, where not to park, where the classroom is located, what time to arrive, where you should eat your lunch, should you bring your lunch. The nice thing with our classroom here at Lafayette is we have a built-in kitchenette into the classroom. So if you have any lunch, any provisions, you can bring them. We also have a cafeteria for you to purchase your lunch if you choose that. I'm also going to send you a review of policy with emphasis on attendance and academics. I'm also going to force that you be in uniform like these young ladies and this gentleman, white smock, black scrub pant, black or white shoe. Ladies, your hair needs to be up. Large earrings cannot be on. If you have tattoos, they need to be covered. And any facial piercings need to be removed. Those documents, by the way, this is why it's in red. Those documents you just scanned to me for enrollment, You have to hand them to me in person in hard copy. If you arrive on the first day of class and there is not, you don't have the documents, I need to send you home to retrieve them. You're not allowed to legally start the class unless I have those documents in hand. And you will get a reminder. These are the 4 emails to look for prior to the start of your class. So you finish the class. Let's talk about certification. When you come out of the class, you are a nurse aide. You want to be a certified nurse aide. Okay. And we start the process of preparing you on the very first day. Okay. So the time you start, the time you finish, all you're going to hear about is the state examination. And that's because we have a very short amount of time to prepare you for this. And we do an excellent job. Our pass rates are in the 90 percentile. There are 2 facets to nurse aide certification. You have to take a written exam. That is 70 questions. It's multiple choice. You take it in person at home in front of your computer. There is an option to go to a test site that would hold you up a couple of weeks to take this exam. If you have reliable Wi-Fi and a laptop or a desktop at home, take it in the comfort of your own home. The second exam is a skills performance. You'll be trained on all the skills you need to know. When you take your skills exam, 5 skills are randomly chosen for you. We have a number of test centers that you would have to go to. One of them is in Philadelphia. We have one at Broad and Chestnut in Center City. We have another test site at Upper Darby. We also have other test sites, Delaware County, Chester County, Bucks, and Northampton counties. Okay, so you will be provided a list of those test centers. But if you're coming from the Philadelphia area, just know you do have a test arena right in your backyard in Center City. We're right across the street from City Hall. We will prepare you for these skills. So in order to become certified and actively on the Pennsylvania Nurse Aide Registry, you will have to pass your written and your skills examination to be an active participant on the registry. So I hope I have answered or covered some of the processes for registration. And I want to see if we have any questions. Mary Ellen, do we have questions in the queue here?
Yes, we do have a couple questions. And thank you,
Good.
Karen. Wow, I learned a lot. So the first question is, so you talk about, why should we go to Bucks? Who are you certified with?
We are a good question, Mary Ellen. We are approved by the Pennsylvania Department of Education. And NURSID, this is one of the first programs rolled out when this federal law went into play in the 1980s. So Bucks County Community College has had a history of nurse aide training since 1989. And we currently run classes at 4 locations. Of course, we have our main campus in Newtown. We have an Upper Bucks, which is the Quakertown area. We have Lower Bucks, which is Bristol. And now we have a new location, which is with you at Holy Redeemer here in Northeast Philadelphia.
And Karen, you mentioned your success rate. Could you say it again? What are chances if I take this course through Bucks that I'm going to pass the national test?
Over 90, right? Currently, we're at 95%.
Wow, 95%.
Currently at 95%. So this is why I stress it's 120 hours. Nurse aides today are skilled. It's not difficult, but it is a commitment. You need to be proficient in English because, and I stress that, because not only are you going to be learning this course, nursing, you're going to get a lot of medical terminology in the course. So it can be quite challenging. So just be prepared for that. It's not, I want to learn how to feed a patient, make a bed. If that's part of it, but there's so much more to CNA training today.
So Karen, let's just say I don't pass the state exam. How many times can I take it?
Well, you're going to pass. We don't want any stinking thinking. But in the event that you become so nervous and you forget everything that you were trained, it's okay. You can retest. You can take the written test 3 times. You can take the skills test up to 3 times. Then the state gives you up to 2 years to do that. So it gives you a lot of time to study. I will say, though, you want to get tested right away because everything we teach you is fresh in your head. So you don't wait. The day you're done, go home and register for that examination. The registration, by the way, is online. It's not through the college. Credentia is the vendor for Pennsylvania. So we will prepare you. We have an information session on how to get you ready for that exam and how to register. It's very, very simple. That's a good question, Marielle. Thank you.
So the first step, though, is to pass the test that Bucks offers. So tell me again, how many tests do I have to pass while I'm at Redeemer?
Okay. There are four major exams. They are multiple choice. And the way we write these is to prepare you for the written exam. Okay. We're not going to give you multiple choice. I'm sorry, we're not going to give you a true or false or fill in the blank. It's multiple choice questioning. We need to develop your critical thinking skill. There is one very easy quiz, though. So we're looking at a student to achieve an 80% before they can move on to the clinical aspect. You do get a midpoint about. So you take your first two tests. We look at your average. If you're under 80, and it happens, I have to reach out to you from my office. I have to put you on academic probation, but you get two more tests to bring that up. And if you can get an 80%, you're going to go to clinical at St. Joseph's Matter.
So if I don't get up to 80%, I'm going to have to drop the course and lose my tuition.
Unfortunately, if a student gets to the end of the theory and lab portion and they haven't achieved an 80%, they cannot matriculate or move on to the clinical portion. What I recommend is that the student go back, you will keep your textbook, study, do the workbook, go back over all your materials. I will allow you to reapply. Okay. However, you would have to pay again. It wouldn't be a free re-enrollment. I do have to stress that.
So what happens if I'm not proficient in English? Will I get extra time on my test?
That's a good question. No. Speaking a secondary language is not considered a learning disability. So, and students who require extra time for testing have to have a medically diagnosed disability before we can accommodate you. And that is a federal law here. But if someone really is unsure of their language or not strong in English, they may want to consider a career in home health before they come onto a CNA program. Home health is very general care. It is how to make a bed, how to prepare a meal, and it would help people get that experience with clients and maybe build their English. And also, if someone is English is their second language, if they reach out to me personally, we do offer ESOL classes here at Bucks to help them become proficient.
And Karen, my last question is, and I'm pretty sure I understand this, that really I can't miss a class. And if I'm sick or if there's a problem, I get one makeup and I have to pay for it.
Let me go over this. The Department of Ed requires you have all 120 hours. So I can't sign your diploma until I legally know you have had all those 120 hours. You can't go to clinical unless you make up all your time. We're one of the few programs that allows makeup. Most programs, the community colleges will drop a student for any lost time. I think that's harsh. So I build in a makeup day for students when life happens, and it does. But know that you will be fine. Okay? Just because you're tired, you don't want to get out of bed, you have to come. But you will have to come in on a makeup day. The instructor has to come in on her day off and rearrange her other job, because my instructors are all registered nurses and they have other areas of occupation. We have to arrange that. Okay, so we do. That does incur a fee of $40 per hour. If you miss a whole day, that is $280 you're going to owe the college. That's an awful lot of money. This is a commitment. The only time I have allowed a student to re-enroll without charge is if they become hospitalized. Okay. That's how strict, and this is not really Bucks, this is Department of Education. They're very, very stringent with the attendance. And that all goes back to a federal law that was written back in the 1980s that we all have to march to in long-term care and in nursing education. It's called OPRA, and you will learn about this in the program.
Well, thank you, Karen. This was a wealth of information. I hope everyone listening is really taking notes and paying attention because we want you to be certified nurses aides.
And ladies and gentlemen, thank you for joining me. And Mary Ellen, thank you for hosting me this morning. If you have any questions, here is my direct email. Okay, if you're going to have any personal inquiries or you have documentation, please send it to my personal email, karen.suvene@bucks.edu. I hope this has been informative enough for you. Like I said, if you have questions, here are my emails. And we look forward to hearing from you in the future.
And imagine being able to put CNA after your name.
Yes, it's a very honorable profession. And if you're considering a career in nursing, it's always good to be a nurse's aide. I was a nurse's aide. Mary Ellen, you were a nurse's aide. And it really gives you a good profile of what nursing's all about because it's not what you see on television. This will really prepare you for the healthcare workforce that we really so desperately need to build today.
Thank you all very much.